Respiratory system. What are the functions of respiratory system? Breathing, gaseous exchange, removes carbon dioxide, speech, olfaction, maintain acid-base balance, and maintain body heat. So these are the functions of respiratory system. Now we'll see what it is divided into two tracts: upper respiratory tract, nose, paranasal sinuses, pharynx, larynx, epiglottis, and lower respiratory tract, trachea, bronchi, bronchioles, alveolar duct, alveolar sacs, and lungs. And what are the organs of respiratory system? Nose. What is the function of nose? Filter, moisten, humidify, and warms air. Receptor for sense of smell. Paranasal sinuses, air-filled cavities that surround the nasal passages. Pharynx, it is passageway for food and air. Larynx, air passageway, voice box. Glottis, epiglottis, a leaf-shaped flap that prevents food from entering the lower respiratory tract. Trachea, it is located in front of epiglottis. Esophagus, it is located in front of esophagus. Tube running from larynx and branches into right and left bronchi. It cleans, warms, and moistens the incoming air. What is bronchial tree? It consists of right and left main bronchi, which divides within the lungs to form lobar and segmental bronchi and bronchioles. The bronchi are lined with cilia. Bronchioles, it delivers air into the alveolar sac. Alveoli, it is site for gaseous exchange. Lungs, right lung is divided into three lobes, the left lung is divided into two lobes. Right lung is larger than the left lung, and the lungs is located from the clavicle into the it is located from the clavicle to the diaphragm. Pleura, it produces lubricating fluid. Now we'll see what are the key terms in respiratory system. Breathing, movement of air and out of the lungs. It is a movement of air and out of the lungs. Second is gaseous exchange, the diffusion of oxygen from the lungs to the bloodstream and the elimination of carbon dioxide from the bloodstream to the lungs that occur between alveoli and capillary within the lungs. So this is called gaseous exchange. Perfusion, blood flow to capillaries. Perfusion means blood flow to the capillary. External respiration, gases exchange between the capillaries and the alveoli. External respiration means gases exchange between the capillaries and the alveoli. Internal perfusion, gases exchange between the capillaries and the tissue. So these are the key terms. Inspiration, expiration. Inspiration, muscle contract, diaphragm moves downward. External intercostal contracts and rib cage moves outward. Thoracic cavity size increases. Lungs are stretched. Intrapulmonary volume increases. Intrapulmonary pressure decreases to 1 mmHg. Airflow into lungs until intrapulmonary pressure is equal to atmospheric pressure. What is expiration? Inspiration, इंस्पिरेटरी मतलब रिलैक्स. thoracic cavity size डिक्रीज हो जाता है. इलास्टिक लंग रिकॉइल पैसिवली. इंट्रा वॉल्यूम जो है वो डिक्रीज हो जाता है और जो प्रेशर होता है राइज हो जाता है टू 1+1 mmHg. एयर फ्लो आउट ऑफ लंग्स अंटिल इंट्रापल्मोनरी प्रेशर इज 0. व्हाट इज द एवरेज लंग कैपेसिटी? मेल का 6 लीटर ऑफ एयर, फीमेल का 4.8 लीटर ऑफ एयर. नाउ सी रेस्पिरेटरी वॉल्यूम्स. Tidal volume, volume of air inhaled and exhaled without effort. Inspiratory reserve volume, the volume of air that can be forcefully inhaled beyond tidal volume inhalation. What is expiratory reserve volume? ERV, the volume of air that can be forcefully exhaled beyond the tidal volume exhalation. And residual volume, the volume of air that remains in the lungs after full exhalation. So this is about respiratory volumes. Now we'll see lung capacity. The volume of air in the lungs after maximum inspiration is a total lung capacity. What is the vital capacity? The volume of air that can be expired after maximum inspiration. Inspiratory capacity, it means the maximum volume of air that can be inspired after expiration. Then functional residual capacity, FRC, volume of air remaining in the lungs after normal tidal volume expiration. What is hyperventilation? Fast breathing. Hyperventilation, slow breathing.